Assalamu alaikum friends, welcome to my channel MBBS and BDS lectures. Today our topic is related with pharmacology, drugs used in cancer or anti-cancer drugs. Before going to topic outline, if you want to watch the same video in Urdu or Hindi, then I already upload a video on my channel anti-cancer drugs in Urdu or Hindi, then you go to watch that video. But if you want to English, then this video is for you. Now we start from the topic outline of topic. Topic outline include definition, classification, each drug detail. First we study definition, then classification of drug used in cancer or anti-cancer drug. Number third is each drug detail. Then we study each drug in detail, its mechanism of action, uses, adverse effect. First we start from definition. What is cancer? Basically cancer, the term cancer we use for that diseases in which the abnormal cell division occur, not normal cell. Abnormal cell division occur without control. Generally the cell division is under control, but when it become uncontrolled, then it is called cancer. And the cancer cell have ability to invade other tissue through blood and lymphatic system. Now the definition is cancer is a term used for diseases in which abnormal cell divide without control and are able to invade other tissue through blood and lymphatic system. This is the definition of cancer. Now classification of cancer. Drugs, anti-cancer drug classification. We classify anti-cancer drugs into 6 groups. Then in this group we put the drugs. The first group is alkylating agent. Second group antimetabolites. Third group antibiotics. Fourth hormonal agent. Fifth miscellaneous agent. Sixth plant derivative vinca alkaloids. Now in these 6 groups, now we put the drugs. In alkylating agent, the first drug is chlorambucil. Second drug is cyclophosphamide. The third drug is alkyl sulfonate. The fourth drug is melphalan. In antimetabolites, there are 3 drugs. Number 1 is folate antagonist, methotrexate. Second is purine analog, which is mercaptopurine. The third is fluorouracil. Fluorouracil. In third group antibiotics, we put 3 types of antibiotics. Number 1 is dactinomycin or actinomycin D. Second is bleomycin. The third is adriamycin. In fourth group hormonal agent, we put prednisolone, flutamide, tamoxifen. In fifth group miscellaneous agent, there are 4 types of drug. Number 1 is hydroxyurea. Second is procarbazine. Third is cisplatin. And fourth is methozentron. These are 5 group. The 6th group is plant derivative, vinca alkaloids. In vinca alkalite, we put two drugs. Number one is vinblastine, second is vincristin. Now we study the classification and drug. Now the each drug detail. In each drug detail, first we start from alkylating agent. Its mechanism of action, its uses, its adverse effect. Alkylating agent mechanism of action. The mechanism of action of alkylating agent is very simple. When we take alkylating agent produce a highly reactive ion which is carbonium ion in our body. Then this carbonium ion do three action. Number one, they doing abnormal base pairing of cancerous cell DNA. The cancerous cell DNA base pairing, they do abnormal base pairing. Second, carbonium ion break the DNA strand. They break the double strand DNA. Number third action, they damage the RNA and protein of cancerous cell. This is the mechanism of action. In mechanism of action, highly reactive carbonium ion is produced. This highly reactive carbonium ion doing three action. Number one, abnormal base pairing. Number two, DNA strand breakage. Number three, RNA protein damage. This is the mechanism of action of alkylating agent. Now its uses. Mainly alkylating agent, if we use broadly, alkylating agent are used in leukemia and lymphoma. Simply we remember alkylating agent is uses leukemia and lymphoma. Uses: number one, leukemia. Number two, lymphoma. Number three, multiple myeloma. And number four, chronic myeloid leukemia. These are the four uses of alkylating agent. Now, adverse effect. The adverse effect of alkylating agent include alkylating agent are toxic to bone marrow, liver, kidney, gut. Mean alkylating agent are toxic to our vital body structure, vital body organ like liver, kidney, gut, bone marrow. Second adverse effect is infertility in male and female. They cause infertility in male and female. Now we study the alkylating agent. The second group is antimetabolites. The mechanism of action of antimetabolites is inhibit DNA synthesis. Antimetabolites inhibit the DNA synthesis of cancerous cell. Now come to the drug detail. The drug detail include methotrexate uses adverse effect. Then mercaptopurine uses adverse effect. And fluorouracil uses and adverse effect. First we start from methotrexate. Methotrexate uses. Methotrexate are used in four places. Number one, methotrexate have a broad range of activity and well-established drugs. Now, methotrexate are used in acute lymphoblastic leukemia of childhood. First use is acute lymphoblastic leukemia of childhood. Second use is cancer of breast. Third use, choriocarcinoma. Choriocarcinoma is the carcinoma of uterus of female. And the fourth use is rheumatoid arthritis. These are the 4 uses of methotrexate. Now come to the adverse effect. Adverse effect, there are 5 adverse effects of methotrexate. Basically, mainly include toxicities. Number 1, immunosuppression. Number 2, nephrotoxicity. Number 3, hepatotoxicity. Number 4, GIT toxicity. And number 5, megaloblastic anemia. These are the 5 adverse effects of methotrexate. Now, if we remember broadly adverse effect of methotrexate, it is simple toxicities like nephrotoxicity, GIT toxicity, hepatotoxicity, and megaloblastic anemia and immunosuppression. Now, second drug, mercaptopurine, uses adverse effect. Mercaptopurine are used in combination therapy for acute leukemia. Mercaptopurine is used for acute leukemia in combination with other anticancer drug. This is the uses. First use. Number 2 use is choriocarcinoma, carcinoma of uterus. These are the 2 uses of mercaptopurine. Now come to the adverse effect. Mercaptopurine have 2 adverse effects. Number 1, myelosuppression, and number 2 is thrombocytopenia, mean deficiency of platelets. Now come to the third drug, fluorouracil, uses adverse effect. Fluorouracil are used in single agent, as in combination with other anti-cancer drug. In single agent, fluorouracil used for colorectal carcinoma, mean carcinoma of colon and rectum. But in combination, it used in breast cancer, stomach cancer, pancreas cancer, urinary bladder, liver. These are the uses when fluorouracil used in combination. Now come to the adverse effect. In adverse effect, there are 2 main adverse effects. Number 1 is bone marrow suppression, and second is GIT toxicity and hepatotoxicity. These are the adverse effects of fluorouracil. Now come to the third group. Antimetabolite is complete. Now come to the third group, antibiotics. Antibiotics mechanism of action, its uses. Mechanism of action include antibiotics mechanism of action is by 2 methods. Number 1, antibiotics inhibit the topoisomerase 2 enzyme, which is responsible for DNA replication and transcription. When antibiotics inhibit the topoisomerase 2, then DNA replication and transcription will be stopped. The first mechanism is that. The second mechanism is antibiotics release free radicals. These free radicals damage the cell membrane and DNA of cancerous cell. These are the 2 mechanisms of action of antibiotics. Now come to the uses. In uses, first we study uses of dactinomycin, then adriamycin, then bleomycin. First, dactinomycin. Dactinomycin are used in Ewing sarcoma, mean sarcoma of bone, mean bone cancer. Second is rhabdomyosarcoma. Rhabdomyosarcoma mean cancer of skeletal muscle. Number third is trophoblastic neoplasm. Tropoplastic neoplasm is that neoplasm which derived from tropoblastic cell like choriocarcinoma. These are the three uses of dactinomycin. Now come to the adriamycin. Adriamycin have a broad spectrum activity. It means adriamycin are used in all cancers. Third is the bleomycin. Bleomycin are used in head neck carcinoma, squamous cell carcinoma, testicular carcinoma. These are the three uses of bleomycin. Now antibiotics is also completed. Now next come to the fourth group, hormonal agent. Its mechanism of action, it uses. Now in sixth group of anti-cancer drug, other group are cytotoxic drug. Mean these drugs are toxic to the cell. These are toxic to the cancerous cell. They damage the cancerous cell. But hormonal agent is not cytotoxic drug. It is a growth modifying agent. It is a cancerous cell growth modifying agent. Like cancerous cell divide very rapidly. It reduce its speed of division. Its mechanism of action is modify growth of hormone dependent cell. These cell which growth are hormone dependent, these hormonal agent modified these cell growth. Its mechanism of action. Now come to the uses. Hormonal agent are used mainly in, if we remember broadly, hormonal agent are used broadly in male cancer like prostate carcinoma, because prostate is only present in male. Second is benign prostatic hyperplasia. This is also present in male. The third is acute leukemia. It is present in both male and female. Number 4, male breast cancer. Male breast cancer, we use hormonal agent. And number 5th is breast cancer of female also. Basically hormonal agent, if we remember its uses, it is mainly used in male cancer like prostate cancer, benign prostatic hyperplasia, breast cancer of male. These are the mainly 3 broad uses. But the 4th is acute leukemia and the 5th is breast cancer of female also. This is the mechanism of action and uses of hormonal agent. Next come to the 5th group, miscellaneous agent. In miscellaneous agent, the cisplatin is most important. Therefore, we study in detail only cisplatin, its mechanism of action, its uses and its adverse effect. Now, start from the mechanism of action. Cisplatin damage the cancerous cell DNA and inhibit the cancerous cell DNA synthesis. It means the already present DNA is damaged and the new DNA synthesis inhibition occur. This is the mechanism of action of cisplatin. It damage cancer cell DNA and inhibit cancer cell DNA synthesis. It is the mechanism of action of cisplatin. Now uses. Uses basically cisplatin are used in testes and ovarian cancer. By this we can easily remember like cysts mostly occur in female ovaries, uterus and male testes, and the drug name resemble with the cyst, cisplatin. Cisplatin means uses testes and ovarian cancer. Now adverse effect. There are two main adverse effects of cisplatin. Number one is vomiting and second is tinnitus. Tinnitus means ringing in the ear. Now the fifth group is also complete. Next come to the last group, plant derivative, which is vinca alkaloids. Vinca alkaloids include two drugs, vinblastine, vincristine. Vinblastine is used for testicular carcinoma and vincristine is used for carcinoma of lung. Now come to the some viva questions, some viva points. The first question is, which drug adverse effect is infertility in male and female? This is alkylating agent. Infertility in male and female. The next question is, which group of drug produce high carbonium ion in our body? This is alkylating agent. Next question is, which drug inhibit topoisomerase 2? This is antibiotics mechanism of action. Which group of drug produce free radicals which damage the DNA and cell membrane? These are also antibiotics. Next question is, which group of anti-cancer drug modify the growth of cancerous cells? These are hormonal agent. Which anti-cancer drug are used in testes and ovarian cancer? These are cisplatin. Which anti-cancer drug are used in carcinoma of lung? It is vincristine. Which group of drug are used for choriocarcinoma? This is methotrexate and mercaptopurine. Which group of drug are used in basically prostate carcinoma? Hormonal agent. Benign prostatic hyperplasia, hormonal agent. Which group of drug are used in main breast cancer? Hormonal agent. Which anti-cancer drug cause toxicities, hepatotoxicity, nephrotoxicity, GIT toxicity? This is a methotrexate. Which anti-cancer drug adverse effect is thrombocytopenia? This is the mercaptopurine. Which anti-cancer drug adverse effect is vomiting? This is cisplatin. Which anti-cancer drug are used in Ewing sarcoma? Dactinomycin. Which anti-cancer drug are used in rhabdomyosarcoma, Ewing sarcoma, trophoblastic neoplasm? This is the dactinomycin. Which group of anti-cancer drug only inhibit DNA synthesis? Antimetabolite. Which group of anti-cancer drug both inhibit DNA synthesis and damage the already present DNA is the cisplatin. Now, today our topic anti-cancer drug is complete. If you enjoy my video, like my video, share my videos and subscribe my YouTube channel and press the bell icon and open the all notification for new coming videos. Thanks for watching my videos.